Go.
Hello, everyone. My name's Anna, and this is our ethical debate project. I will be introducing our members as well as talking about current research that deals with mandatory ABA in free and appropriate public education. I will also present visuals and introduce opposing arguments. First, we have Alyssa.
Hi.
She will introduce the pro side and will present visuals. Next, we have Janice.
Hi there.
She will introduce opposing arguments as well as act as summarizer for the opposing side. Next, we have Abigail.
Hello.
She will be acting as a summarizer for the pro side and fielder by identifying potential questions. Lastly, we have Christina.
Hello.
She will introduce a second point on the pro side and will back up her points using visuals as well as summarize closing statements. Our debate will follow a more conversational, informal format. First, we have Alyssa stating why ABA services should be appropriate.
A free and appropriate public education should include mandatory ABA services for children with ASD in schools. A study from Chowka 2004 states that ABA is firmly established as among the most visible and frequently cited autism programs, and it's among the most broadly requested and implemented public school treatments by educators, service providers, and parents. ABA services in the public school system can bring more resources to an individual with ASD by allowing a BCBA who is trained in behavior to work with the child and train other staff members in those evidence-based practices. The goal of ABA therapy is to apply our understanding of how behavior works to real-world situations by increasing behaviors that are helpful and decreasing those behaviors that are harmful. ABA therapy programs can help to increase language and communication skills, improve attention, focus, social skills, and academics, as well as decrease those problem behaviors. These are all skills that can be taught within the public school setting where these kids spend the majority of their time. These are skills that are necessary for individuals with ASD to be successful in their futures in order to be able to continue into post-secondary education, receive paying jobs, and just live more independent lives. Callahan 2008 study states that anecdotal reports by teachers, parents, and administrators suggest that the inability of many school districts to deliver high-quality autism programming is an area of widespread concern. So without these ABA services in the public school system, we're ultimately decreasing the chances that these individuals will be able to have more independent and successful lives. Code 2.09, treatment/intervention efficiency, does state that clients have the right to effective treatment, as well as behavior analysts, we have the right to advocate appropriate level of service required for clients. So if we feel like these services are best met in the school setting, that's where we should be providing these services. Janice, would you mind putting up my visual, please?
Absolutely.
Thank you. So this visual is a graph of what happened to young adults with autism between high school and their early 20s. This is from the National Autism Indicators Report from 2015. As you can see, 74% of individuals with ASD had access to services after graduation, 58% found paying jobs, 36% attended post-secondary, and only a small amount, 19%, were able to live independent. So I truly think that providing these services within the public school setting is helping to set these individuals with autism up for success for their futures. So I'm going to go ahead and pass it off to Janice so that she can talk about her side of this topic.
Hi there. So I'm going to introduce our opposing argument, and I want to start with some information regarding significant elements of ABA from Jane Howard and Colleen Sparkman, who are both BCBAs specializing in individuals with autism, specifically early intervention. In their research, Howard and Sparkman identified the most significant elements of ABA as intensity, which is generally defined as 30 to 4 hours per week of intervention, a rich ratio of teacher to student attention, and maximize learning opportunities. I think these are all things that we can argue with and strive to create in our own practices. After all, significant research supports the effectiveness of ABA interventions with children affected with autism. There are principles and codes that will withhold its standards, including the BCBA Compliance Code 8, public statements. And that includes things that includes avoiding false or deceptive statements, advertising, and such. My argument stands that if we provide or we claim to provide ABA services in schools, will it maintain the integrity of what we see with the behavior analyst, BCABA, and trained RBTs to support it? Our current public school education data suggests many teachers feel overwhelmed and underpaid and overworked. According to Teachers in California database, many teachers are working off of short-term staff permits provided as waivers from districts that are unable to recruit suitable credentialed staff. So we have to go back to our ethics code and consider, is it just to put unfamiliar entry-level staff members into positions where they are supporting up to 12 students at a time? And that being said, where they would be learning principles that are intense, rich in ratio, and would they be able to really maximize those learning opportunities? What do you think, Abby? We're going on to Abby next.
Next is Anna.
Anna is next, I believe.
Sorry about that.
Anna?
Oh, I think you just might be on mute.
Okay, so I'm on the opposing side. So research says ABA services should not be mandatory for children and youth diagnosed with ASD in schools that provide free and appropriate public education, because an appropriate education is tailored to all students, not just one individual student. It provides the best education for all. According to Ethical Code 4.03, it states that a behavioral change program is individualized and tailored to change unique behaviors, environmental variables, and goals of each client. Therefore, ABA should not be mandatory because each student is different and needs individualized attention. If not all students with a disability will get paired with an instructional aid, then ABA should not be mandatory during the school setting. Although early intervention can be very rigorous, special education classes are different in that it provides the students with an education regardless of disability or special needs. According to the Autism Speaks website, extended school year services are provided to youth that have regressed skills, not to teach a new skill, but to continue with a regressed skill. This is appropriate for those students that need services before going out to the real world, such as when they are done with high school. Ethical Code 4.07 states that behavioral analysts should recommend other professional assistance if environmental conditions interfere with the implementation of a behavioral change program. This ethical code fits perfect with this topic because there is so much a school can do and can afford. The first visual, which is figure 3, is a change of prevalence over the past decade for students with disabilities. We can see there has been an increase of children diagnosed with autism, and it has almost doubled over the past decade. The next figure is my second visual. It's about special education expenditures and how it has slowly increased since 2004. We can see an inflation of federal IDEA ARRA, which is the American Recovery and Reinvestment Act of 2009. This includes recovery funds for services to children and youth with disabilities. Therefore, we have to be more diligent on how the money is used and how it is applied to all the children, not just one. And then What do you think, Abigail?
Hello, I am on the pro side of this argument, and I believe that having access to high quality educational services that promote independence and self sufficiency is very crucial for children with autism in a classroom setting. Spending 40 hours a week around that in a classroom setting could really benefit getting services in that setting. Lacking proper services can affect an individual with autism to develop the necessary social and behavioral skills needed to live independent lives. Verez Ortega, 2010, found that the greater the treatment intensity and longer the treatment duration, more positive effects were seen in intellectual functioning, language, and adaptive behavior. With treatment intensity being a major predictor of positive effects, providing these services during school hours will provide individuals with autism the treatment intensity needed to see these improvements. Research shows that mainstreaming children with autism will show increased engagement in social interactions, increased levels of social support, and improved educational outcomes. All other studies have shown that social behaviors were able to be generalized better when taught in an inclusive environment rather than in a segregated environment. And providing ABA services to children with autism in a mainstream setting allows for students to receive the intensive intervention in an environment that best promotes generalization, a skill that can sometimes be difficult for children with autism. Related codes to this issue are 2.09, treatment intervention efficacy. Clients have the right to effective treatment. And as behavior analysts, we have the right to advocate appropriate level of service required for clients. So providing it with treatment intensity is the best way for the client to receive this. Also, code 4.03, individualized behavior change programs. As behavior analyst, we can tailor the behavior change programs to unique behaviors, environmental variables, and the goals of each client. ABA services provided to students in a public school setting will allow exposure to social interactions with typically developing peers while incorporating the necessary intensity and duration accessible during school hours. Janice, if you wouldn't mind showing my first visual.
Sure, here we go.
Thank you. This visual compares treatment gain between intensive ABA services around 30 hours a week, intensive multi-treatment, including 30 hours of ABA, including other services such as OT, speech therapy, and then it compares low intensity multi-treatment services totaling around 15 hours a week. And it shows the median testing score and learn rate. And as you can see, intensive ABA hours totaling around 30 hours a week show way more of skill increasing for these individuals. Janice, if you wouldn't mind showing my second visual.
Absolutely, here we go.
Thank you. And this visual displays feedback provided by parents and caregivers of children receiving ABA services at high intensity, and all feedback received was positive from most parents and caregivers. They also found the program very helpful to these individuals. I am going to pass it on to Christina, who's on the pro side.
Hello. So I have on the pro side that students with autism spend 5 days a week in school from 8 to about 2, which is about 1,000 hours according to ED 100, just like a typical student. After these long hours, they are expected to attend speech, PT, or even ABA after school. Some students get approved up to 40 hours a week for ABA according to Child's Play Autism. This is the amount of hours that was recommended by our researcher, Ole Lovis. If we think about it, if ABA becomes mandatory in schools, these students with autism will be able to complete their recommended ABA therapy hours. According to Yale and Duggar, so ABA has been mandatory in some schools, but special education teachers, they don't know how to implement this. However, so that's what students are losing precious time when they could have maximized their potential. In the case of in 1975, the Education of All Handicapped Children's Act, IDEA, was passed to give students with disability a voice because it was found out that students' needs were not fulfilled by teachers. In the case of Hendrick-Hudson Central School District versus Raleigh 1982, it ruled that every student's education should be unique to each student in order to maximize their learning. The problem is that it's left to the states to decide what would be an appropriate education for them. And if we have a BCBA in schools, they will be able to help students tailor programs in order to fulfill their behavior needs. Code 4.83, it says that the program should be unique to behaviors in the environment. So behavior analysts could come into the schools and help tailor the programs to their needs. Also, this case, it ruled that the money expenses will come from the public since it is a public education. It also ruled, it's called the Raleigh standard. So whenever a parent has a case against the school, they have to prove that the IEP, that they need to prove that the child's program's history, that there hasn't been any improvement. And could Janice, can you please show my first visual?
Absolutely. Here we go.
So on the first visual, I have here a bunch of court cases that parents took against the schools. And one of the big problems was that the qualifications of the personnel in schools, it was that the children in their IEP, they had to have ABA training, but the teachers, again, they didn't know how to implement this, so the parents took this to court. In the case of Delaware, the parents said that their son Paul was in the IEP, they had a program named TEICCH, which is an intense therapy, and it was not provided to him. And I also have, according to Texas Education Agency, they report that in 2007 to 2009, that teachers did about 52,000 restraints. Having a BCBA in schools, they can help teach teachers how they should handle behavior. And code 2.03, it says that whenever appropriate, behavior analysts should team up with other professionals for their clients' benefit. And just the behavior analysts, they could team up with teachers in order to help the client because they are having behavioral issues. And Janice will show my second visual.
Here we go.
So on my second visual, I have here teachers that they have been accused. One teacher held down the students' hands down and then they start blowing a whistle in order to correct their behavior, which is definitely unethical. And then the other two teachers, they put their two students in a bathroom for 90 minutes and they left them there because they were not behaving in the classrooms. So again, if we have a behavior analyst inside of the schools, they can help them with help the students with their behavior. And I'm going to pass it on to Janice.
All right, so I'm going to take a slide here. There we go. And just to close for our opposing side is that I think that, we all bring up some really great points about the benefits of ABA. And I think that there are sides of it that would be very helpful in schools. However, when we look at the true principles of ABA and the ethics that would be implemented, making sure that it's an intense merchant ratio that maximizes learning opportunities, I do have to wonder if there would be enough BCBA supervision and trained RBTs to implement the procedures we talk about.
Christina, you're still on mute.
Okay. So, as mentioned before, ABA is an intensive evidence-based treatment, and Pioneer Levis mentioned that it should be taught early in school, and it will be great if the earlier it is done in school, the better the outcome. And as mentioned before, only 58% of the population could find employment, and that is something to consider about that. It should be mandatory in schools in order for a greater outcome so they could be independent. And next we have Abigail.
So to wrap up our debate, I have potential questions that would be asked on everyone's thoughts. And the first one would be, how does an IEP play a part in ABA services? So in order for a parent to advocate for their child to obtain ABA services, they must request an IEP meeting. During this meeting, an evaluation would take place, observing areas of strengths and weaknesses of the child. The team would then identify appropriate goals for the child to work on within the school year based on observations made, as well as the individual needs of the child. In order for the child to receive ABA services, it must be deemed appropriate and be written in their IEP. Schools are not responsible under FAPE to provide ABA services to all students with ASD, making what is determined in a child's IEP very crucial. A next potential question: are teachers qualified to provide ABA services? While most ABA principals are carried out by teachers who have been certified or well-trained, ABA programming should be supervised by qualified professionals, such as a clinical psychologist with training in ABA or a board-certified behavior analysis. School systems offering professional development to teachers to increase knowledge about autism and principles of ABA can be an effective way to provide more qualified ABA services day to day. Another question, what would be considered intensive ABA therapy? Intensive ABA therapy refers to programs providing at least 25 to 40 hours a week of intensive ABA therapy. And a last potential question would be, what are other options if ABA services are not provided by a child's public school? Some private insurance companies will cover the expenses of ABA services. However, the amount of hours an insurance company will cover depends on the child's needs. It is not guaranteed an insurance company will cover the amount of hours needed to provide intensive ABA therapy, making providing ABA therapy in schools very important for children to receive intensive programming, which is more effective when delivering ABA therapy. Thank you so much for listening to all of our points on providing ABA services in public education.
Thank you.